everybody, if you have had chronic pain, especially nerve pain, PTSD, depression, substance use disorders, then this video is for you. My name is Alexandra and today I have with me Dr. Mohan with Pain Specialist of Frisco.
Thank you for the introduction. I'm Dr. Mahesh Mohan and today we are discussing ketamine. And this is part of our series Pain Specialist of Frisco. And a word of caution, this is only an educational video. Please follow your doctor's advice for treatment.
Dr. Mohan, let me start by asking, what is ketamine?
Well, ketamine is a drug that was developed in 1960s as a derivative of phencyclidine, and it was developed in pursuit of a safer anesthesia drug. Ketamine induces a dissociative state where one feels a little detached to the body or a little less concerned with what's going on, and that can really help in anesthesia. And in addition, it also stimulates opioid receptors, which potentiates the action of morphine, and it also is a blocker for NMDA receptors for glutamate. So the last part is the one that is having more importance nowadays for the use of ketamine. And in addition, it can also increase BDNF and it can also increase mTOR. So there are multiple ways ketamine can be working. If you look at the mechanism of action for ketamine, the primary action is it's a blocker for the NMDA receptor for glutamate. The secondary actions are that it could increase BDNF in the neurons, it could increase mTOR, it could indirectly stimulate AMPA receptors, and this has significance in increasing neural plasticity.
Could you please tell us more about the uses of ketamine?
Sure. First and foremost, it is an anesthetic agent. It induces dissociative anesthesia, which is better for having a sense of detachment, and in addition, it potentiates the effects of morphine, so it can have significant pain control too. And in addition, it is a little different than most anesthetic in that it stimulates the cardiovascular system or the heart and the blood vessels. So it could maintain the blood pressure or even increase it a little bit. And it does decrease the respiratory drive a little bit, but it is much less of a depression as compared to other anesthetic agents. So that is a big benefit too. And in addition, people usually maintain their airway, which is essential. And also it can have some degree of bronchodilatory effect, which would be really helpful in an asthmatic patient. So it has multiple effects, and it's a very safe anesthesia drug, especially out in the terrain, like in a situation like war. It's a really helpful drug.
Oh, I think I heard about this. It was used in Vietnam War, right?
Exactly. And even now, ketamine is a very beneficial thing when out of the way painful surgeries are done, and it's especially useful if there is opioids on board, like somebody is taking Suboxone, and then the pain relief effect is not great just with opioids alone. So ketamine can supplement it.
Interesting. Are there any other uses besides the one mentioned?
Certainly. Chronic pain, that's what we do, is another field where ketamine is used widely. It decreases the neuronal sensitization or the wind-up phenomenon in spinal cord, so that becomes especially helpful in neuropathic pain. While I was in Case Western University in Cleveland, we extensively used ketamine infusions back in 2015, and we had excellent outcomes. And in addition to chronic pain and being an anesthetic, there are other newer uses which are mostly in psychiatric field, including in the situation like depression, anxiety, OCD or Obsessive Compulsive Disorder, or SUD or substance use disorder, or PTSD or post-traumatic stress disorder. In 2019, FDA approved Ketamine, which is a nasal spray for use in depression. All the other uses are off-label use.
I'm curious about depression and how actually it works.
Well, in addition to the effect in NMDA receptor, ketamine also increases BDNF in neurons and also increases mTOR and also indirectly stimulates AMPA receptor. The mTOR or exposure to ketamine also stimulates the dendritic growth in neurons, which is important for forming new synaptic connections.
Oh yeah, I heard about mTOR. That's the one that helps the cells live longer in our body, right?
Yeah, that's right. And in addition, ketamine increases the synaptic connections, and usually synaptic connections are less in depression. And since ketamine increases the connections, that's how it helps in depression.
We discussed the uses of ketamine, but I'm also curious to know when you cannot use it.
Sure, there are situations. It's better avoided if there is significant hypertension issues like uncontrolled hypertension or uncontrolled unstable angina. It's also better avoided in situations where the intracranial pressure is raised or intraocular pressure, that's the pressure within the eye, is raised, or in uncontrolled psychosis, it's better avoided. It's also better to be avoided in severe liver disease, including cirrhosis, since the drug is metabolized or broken down in the body, in the liver, and it's better avoided in pregnancy and also in uncontrolled psychosis. If you have had a prior poor response to ketamine, it's better avoided too.
I'm sad to understand that ketamine played a partial role in the demise of Matthew Perry. He had the role of Chandler Bing in Friends.
Yeah, same here. I'm also a huge fan. Ketamine is a strong drug, so when it's used in community setting, they could, it could lead to bad outcomes. That's why we promote infusion in our setting, where it's a supervised, clinic-based infusion, which is way safer. Again, to reiterate, ketamine is a very safe drug when done in a hospital setting or a clinic setting like ours, when it's done supervised. It's been in use since the 1960s and it has proven track record. And in addition, we can also make sure that we give it to the right dose.
Can you please explain us the process if someone contacts your clinics, like what are the steps?
Sure. The patient needs to be assessed thoroughly. First, I have to really listen to the patient and review the treatment records, get some imaging studies, get some blood work, and come up with a appropriate treatment plan. And the bonus about coming to our clinic is that we are a chronic pain clinic or regenerative medicine as well. So we are able to determine the real root cause of the problem, and we can fix it or help fix it. That will alleviate the psychiatric load or the chronic depression load.
What is the process? How it's done an infusion ketamine?
Sure.
In your clinic?
Every patient is different, so the treatment is tailored to the patient. Usually, we follow a pattern of 6 infusions over a period of 3 weeks, and after that we do weekly infusions for a couple of weeks, and we taper down to 1 in a couple of weeks infusion. In the longer process, in the longer term, the ketamine could be continued as a nasal spray also.
As with any treatment, there also could be some risk. Could you please elaborate on it?
Sure. The most common side effects are nausea, which is feeling of throwing up, vomiting itself, confusion, dizziness, diplopia, which is seeing double, and rarely hallucinations. That being said, ketamine is a very safe drug when done correctly in a hospital setting or a clinic infusion setting, and that can be the answer to a growing list of problems, including chronic pain or intolerance to or opioid tolerance, neuropathic pain, depression, anxiety, substance use disorder, post-traumatic stress disorder, obsessive compulsive disorder, and I think we are gonna learn much more.
Hopefully Dr. Mohan answered some of your questions today in this video. If you have any more questions, please feel free to reach to us. Have a blessed day.
Have a blessed day.